Hello students, today we will be discussing about SHBG, what SHBG is. So SHBG is sex hormone binding globulin. It is a protein carrier. In the previous video we discussed what protein carriers are and why are they needed. What is the role of protein carriers and what if the protein carriers are not there, the hormones will be free in the blood, and what is the disadvantage when the hormones are free in the blood. So all that we discussed. Where is SHBG produced? It is produced in the liver. So any disease which is affecting the liver will reduce SHBG and hence the consequences. What are the conditions in which SHBG increases? Hyperthyroidism. Anything which increases thyroxine will lead to increase in SHBG. Pregnancy is a state when SHBG increases and hence the total hormone increases, although the free hormones remains the same. Another is estrogen administration. Whenever we are administering estrogen, we are giving the OCPs, at that time the SHBG increases. What decreases SHBG? Corticoids like Cushing syndrome, androgens, any state which is leading to hyperandrogenism, which is most common is PCOS, which leads to decrease in SHBG, and hence the unbound hormones, the free hormones, they all increases. That is the reason there is increased testosterone and hence hirsutism in the patients with CAH, in the patients with PCOS. Progestins. Weight gain. Anytime the weight put on is there, excessive weight gain will lead to decrease in SHBG. So there is a direct proportion rather. A low level of SHBG is a predictor for development of type 2 diabetes mellitus. Whenever there is increase in the weight gain, that will lead to low level of SHBG, and that is in a predictor of development of type 2 diabetes mellitus. Insulin. Hyperinsulinemia will lead to decrease in SHBG. So that is also one of the reasons why in diabetes the insulin resistance is there, and there is decrease in SHBG that will lead to hirsutism and all the consequences. And there is one more factor, insulin like growth factor. All these acanthosis nigricans, all these things are because of decrease in SHBG. Then growth hormone also decreases SHBG. So these are few things which increases SHBG, decreases SHBG, and why SHBG is important, why the protein bound hormones are more important rather than the free hormones. Any imbalance in SHBG will lead to either the free hormones will lead to increase if the SHBG decreases, and hence the consequences. So that's all for SHBG. Thank you.